cytoplasm. Okay, having said this, it is also you must also know how these different white blood cells are differentiated based on the presence of the nucleus, not only the presence of the nucleus, but depending upon the size of the nucleus, the color of the granules, there are various distinguishing features by which these white blood cells are distinguished from each other, like the neutrophils, which have often more than 3 nucleus, the lobes of the nucleus are more than 3, and then there is the basophil, there are eosinophils. The basophils has dark blue colored granules in the cytoplasm. The eosinophils has pink or brick red granules in their cytoplasm. In the basophils, the nucleus is completely obscured by the presence of large number of granules, whereas in eosinophils, there is a typical spectacle shaped nucleus, bilobed nucleus, isn't it? And then there is monocyte, which has a typical kidney shaped nucleus. And then there is the lymphocyte, which has a very large nucleus, which covers almost most of the area of the cytoplasm. So why is it essential? So today the class is about how we do the differential leukocyte count. So what do you mean by differential leukocyte count is that, so you know that you have already done total RBC count. We've already studied about the total leukocyte count. So this total students, could you please mute your mic? Roma Khan, please mute your mic, because yeah, okay. So what was I saying? Okay, so you studied about the total leukocyte count, total RBC count, in which the total number of the cells were counted, because based on this counting, which is a part of the routine examination of the blood, diagnosis can be made about various clinical conditions. So today we are going to talk about the differential leukocyte count. So what do you mean by the differential leukocyte count? Is that when we are doing a differential leukocyte count, we are counting the number of the leukocytes, different kind of leukocytes in a given blood, in a given field or in a given area of the slide. So here we are going to count in total leukocyte count. We did not specifically count different kinds of leukocytes. We counted just the total count of it all. But in differential count, we are going to count and measure the percentage of individual cells. Like what is the percentage of neutrophils, what is the percentage of eosinophils, percentage of basophils. So each cell, different kind of cell is to be counted, and their percentage has to be calculated. So why is it essential? Why is differential leukocyte count essential? Because there are different kind of diseases, different kind of conditions, different types of the clinical conditions in which each individual cell might increase. Say, as for example, once you do a differential leukocyte count, then you can see the count of neutrophils, count of eosinophil, basophil, lymphocyte, and monocyte separately. So as for example, say if you advise a differential leukocyte count in an individual, and once you examine the report, if you see that there is increase in the number of the neutrophils, but the other that it could be a case of acute infection, because it is usually in very acute infection that the neutrophils are very rapidly increased. Similarly, if you take a look at basophil, the basophil are usually increased in allergic conditions. Similarly, the eosinophil, which are basically enlarged or increased in number whenever there is any kind of parasitic infestations. So depending on the count, on the differential leukocyte count, you can get a knowledge about what the individual's health status is. Is he suffering from some acute infection? Is he suffering from some chronic infection? Does it look like he might be having some allergic responses to something? Does it look like he might be infested with worms? So these are the various information that you can get from a differential leukocyte count. All right. So having talked about the significance of the differential leukocyte count, now we are going to study about how we do this differential leukocyte count in the lab, in the physiology lab. And it will be easier once you, I tell this again and again because of course the practical is not complete until you have your own hand, you know, until you do it yourself, hands-on, you will not understand. But then yeah, it is just, you know, just I will explain to you theoretically, and as always there is a video at last, so you can kind of grasp a concept about what it is and how it is done. Students, do you understand? Please let me know if I'm not audible, or please let me know if I'm too fast, if I'm too slow, if it is too difficult, anything, just let me know. All right, so having assumed that you have understood, now I will proceed to the various apparatus, the various that is required for the DLC count, and the procedure by which we do the DLC count. So in last class, I was informed that Dr. Ansu had asked you to find out a little detail about the Leishman stain. Yes or no? Prabhat, Diditi, Priyanka, Diti. Priyanka.
Yes, ma'am.
So have you found out about Leishman stain? Have you taken the pain of going through your books, textbooks, or internet, or anything as such?
Ma'am, I did a bit of the just on net.
Okay, can you tell me what are the different apparatus that is required for carrying out this differential leukocyte count examination? Priyanka.
Yes, ma'am, I'm here.
Okay, do you have a notebook in front of you so that you can, or anything, if you just remember it, it's okay. If you have written it in your notebook, that's also okay. So can you tell us what are the different apparatus that is required for us to carry out this DLC count?
Ma'am, I'm not able to recall.
You are not able to recall. All right, no problem. Okay, then I will share. Okay, no problem. Thank you, Priyanka. So I will share with you a slide that I have prepared, which will be easier for you to follow. So just give me a second so that good. All right. So is my slide visible? Okay, sorry,
Yes,
this is wrong slide. Just give me another minute. Full blood smear. Okay. So is it visible, students, the differential leukocyte count? Yes, slide is visible. Yes?
Yes, ma'am. No, ma'am.
No, I think it's just
No, ma'am.
loading. No, not yet.
Yes, ma'am.
It's
Yes. All right.
Yes, ma'am.
All right. So in this case, there are a few things that you have to remember while you are doing differential leukocyte count. Unlike the total WBC count or the total RBC count, it is not done using the improved Newberg's chamber. So this entire experiment is carried out. The cells are counted within the glass slide only, on which you have prepared the blood film. So here the principle is that once you collect the blood sample and you prepare a blood film, it will be stained with a special kind of stain which is called as the Leishman's stain. Okay, so once it is stained, there are various techniques to staining this film. So once you've stained this blood film, then you will scan it under the cells are counted under the high power objectives, under the oil emulsion or oil immersion, because it is not possible to distinguish the different kind of leukocytes on low power objective or the high power objective. Rather, it should be under the highest, that is the under the oiled immersion. It should be examined and counted. Similarly, the total number of cells that you are going to count is going to be 100. So you are going to count 100 cells. And then the percentage distribution of each of the cell is calculated. So whenever you count 100 cells, among that you can, once you identify how many is neutrophils, say out of 100, if you find 60 neutrophils, then it means that 60% of that sample, 60% is the neutrophil count. Similarly, if you find say 1 or 2 basophil, then it means that 2% is basophil. So this is how you will be counting. So there are a few things that is very, very important for you to remember. Number one is the apparatus that is required. Specifically, you should remember that we use a special kind of stain, and that is called as the Leishman stain. So you can see here in this picture that the Leishman stain comes, it's a deep blue or violet colored fluid that is usually available in a manufactured, like you do not need to mix anything and create a Leishman solution. It is available commercially as a prepared solution. So what are the various instruments you require? Okay, so for the various instruments or various apparatus that you required, of course, for pricking the finger, you know the precaution, you know the instrument. So all the apparatus that is essential for obtaining a nice clean prick is, that is the cotton swab dipped in alcohol, and then you need blood lancet, and for making a smear you need good quality glass slides. It is often advised that you make 3 slides so that you can choose the best slide among the 3, because there is always mistake that is happening. So you can, just to be on the safe side, you can make 3 blood smears. Similarly, you required Leishman stain, and the other apparatus are distilled water, staining rack, there is tap water, and you need a microscope for visualization of the cell. Now we are talking about the Leishman stain here, which is one of the important, say, constituent or important component of this experiment that we are carrying out. So what exactly is the Leishman stain is that this Leishman stain is used for staining the nucleus as well as the granules of the leukocytes. So it should consist of dye, obviously, because dye is the main agent that helps in the staining. So it consists of 2 kinds of dye. One is the acidic dye, which is called as the eosin, and the basic dye is called as the methylene blue. Okay, so the acid dye or the eosin is actually, it is used for staining. It is acidic, means it is negatively charged dye, so it goes and stains the positively charged particle. So when we say positively charged particle, it means that this eosin stains and it gives like the red or slightly pinkish color to the red blood cells, as well as it gives the color to the granules of the eosinophil. So since the stain that is taken up by the cells, the red colored granules are taken up, or the brick red colors are taken by the eosinophil, so you can just in your mind refer, because it is because of the eosin component that the because it loves eosin, it is called as the eosinophils. The granules love eosin, so they combine with the acidic dye eosin, giving it a slightly red or pinkish stain to the cell, specifically the granules of the eosinophil and the RBC. So one composition is the acidic dye eosin. Similarly, this methylene blue is the basic dye here. So this basic dye or methylene blue is responsible for the giving stain or coloring the nucleus of all the leukocytes. So we know that the nucleus of all the leukocytes is blue in color, or deep purple or violet, however you'd like to call it. So that is given by the methylene blue. Similarly, the granules of the basophils also. We know that the granules of the basophil are blue in color or deep purple in color, and that is imparted by the methylene blue dye. So this acidic dye eosin and the basic dye methylene blue, both of them are dissolved in 0.15% of acetone-free and water-free methyl alcohol. So what you should keep in mind here is that you should not forget to say the acetone-free and water-free methyl alcohol, because here comes the question, why should it be acetone-free and why should it be water-free? This is very commonly asked question in your viva, in your practical as a long case, in the long case where you have hemat. So it is commonly asked question. So there are few answers to this. There are few causes to this why it should be acetone free. So number one is that the acetate and the methyl alcohol is actually, the methyl alcohol is used because it is very good fixative agent. So when I say fixative agent, it means that it can easily, whenever we add this, whenever this acetone is added, sorry, this methyl alcohol is added to the solution, what happens is that it helps in attaching, or it helps in sticking the blood smear to the blood slide, the slide itself. So the slide will easily nicely attach the blood film so that it will not be washed away. Whenever you are washing the slide later, as you will see in the experiment, this smear will not be washed away. That action is provided by the methyl alcohol. Similarly, the other function of the methyl alcohol is that it helps in precipitating of the plasma proteins that is present within the blood, and by also precipitating plasma protein, it also helps in the preserving the morphology of the cells. Okay, so the methyl alcohol helps in preserving the morphology of the cells, the correct shape, the correct size. That is the function of the methyl alcohol. So what are the functions of methyl alcohol? Number one is that it acts as a fixative. That is, it helps in sticking the blood smear to the to the glass slide. Number two is that it precipitates the plasma protein. Number three is that it helps in preserving the morphology of the cells, or the cells that has to be studied under the microscope. And why does it have to be acetone free? Is that because if there is presence of acetone, the nature of acetone is that it is a very, very strong lipid solvent. So when we say it is a very strong lipid solvent, it means that it has the capability to disrupt the cell membrane, because the cell membrane is lipid mostly, isn't it? It's a lipid bilayer with proteins embedded in between. So this acetone is capable of disrupting this lipid component, and this might result in the complete disruption of the cell itself. So the cells might be destroyed, lysed. Even if it is not lysed or destroyed, it might be able to cause shrinking or crenation of the cells, which will not give us the accurate reading, because the actual morphology of the cells will be destroyed. So this is the reason why the solution that we use here should be acetone free. Similarly, it should also be water free, because if there is presence of water, then it might result in the stacking of the RBC upon one another, which is called as the rouleau formation. And it might also, prevent the sticking of the blood smear to the glass slide, and it might be washed away when you are, washing with tap water later. So it might not preserve the blood smeared on the glass slide. Understood, everybody? So these are the reasons why the different composition are used. So this is very, very important. The Leishman stain, the composition of Leishman stain, and what are their individual functions. So the acidic dye, it is used to stain the eosin, used to stain the basic particles. The basic dye is used to stain the acidic particle. The eosin is imparting the pinkish or the reddish color to the cell and the granules, certain cell and the granules. Similarly, the basic dye or the methylene blue is imparting the blue color to the nucleus of the leukocytes as well as to the granules of the basophils. And the importance of this acetone-free and water-free methyl alcohol is that it is used so as to preserve the structure of the cell, so that there is no disruption on the cell membrane, there is no lysis, there is no crenation of the cells. So this is the reason why Leishman stain is used, and the use of each individual component of the Leishman stain. All right. So having said that, now let us go to the steps. What are the various steps that are required in order for to proceed with the differential leukocyte count? So the first and foremost is the preparation of blood film. So once you have chosen which finger is to be pricked, And once you have appropriately pricked your finger, a blood drop has been formed. You know the process, you know the various what are the various precautions that you have to take before you prepare the blood film? What are the techniques by which an ideal film can be obtained? What is an ideal film? You know all of this, so I'll not be going into detail. So you need 3 different slides and you need a spreader. So you need to prepare a good blood film or a blood smear. So once an ideal blood smear has been formed, or you have prepared an ideal blood film, then you should dry it, let it dry for some time, and then we shall now proceed with the staining of the slide so that we can do the differential leukocyte count. So what are the steps in the staining? So the second process, once your blood film has dried, is the fixing and staining the blood film. This process is called as fixing and staining. So when we say fixing, it means that once you have prepared the blood smear, now we have to stick it so that it does not come off. You have to stick it onto the slide firmly and you have to stain it because we have to distinguish the different types of the leukocytes, and that requires proper staining. So how do you do it? Is that at first, the first step is that this prepared smear that you have made, you have to place it on a staining rack. Okay, I'll show you what a staining rack looks like just in a second. So you have to place it on a staining rack, and then once you place it on the staining rack, you have to add about 8 to 10 drops of Leishman's stain. So by adding 8 to 10 drops of Leishman's stain, now you wait for 2 minutes. Okay, so this waiting of 2 minutes is done to initiate the process of fixing, meaning that within these 2 minutes, when you pour the Leishman's stain, the first thing that happens is fixation, meaning that it will help in adhering the slide, adhering the blood film to the glass slide. And then after 2 minutes, you will add double the amount of the distilled water, double the amount of Leishman stain. Say if you've added 8 drops, then you will add 16 drops of distilled water. So after 2 minutes, you will add 15 to 20 drops of distilled water. And the function of this distilled water mixed in that Leishman stain is that now it will help in the staining of the individual cells. Appropriate staining is going to happen, followed by this distilled water is going to help in the ionization, and that ionization is going to help in the appropriate staining. So number 1 is preparation of the blood film. Number 2 is fixing and staining. So when you are fixing and staining, the first thing that we have to do is in this prepared blood film, we have to add about 8 to 10 drops of Leishman stain, and then we have to wait for 2 minutes. In that 2 minutes, what's going to happen is that the blood smear is going to be fixed onto the blood slide and the glass slide. Forgive me for this confusion. And then after that, we have to add double the amount of the Leishman stain. We have to add double the amount of the distilled water. So if you're using 8 drops of Leishman stain, you have to add 16 drops of distilled water. Now, after adding this distilled water, you have to wait for about 8 to 10 minutes. And this 8 to 10 minutes is the time that is taken for the distilled water to ionize the Leishman stain, and following the ionization of this entire stain, the ionization procedure will impact the staining of the cells. So this is when the staining is going to happen. So after about 8 to 10 minutes, once you've waited for about 8 to 10 minutes, what you're going to do is you are going to wash the stain. So you can see here, this is the staining rack here. As you can see, this is the slide that has been placed, the stained slide. You can see that it consists quite a lot amount of fluid in here. So maybe we can just make it out by looking at this glass slide itself, that it has been stained by the Leishman stain, as well as it has been the distilled water has also been added to it. So once the distilled water has been added, you can just gently rock this slide side by side so that the liquid does not pour out of the slide. Rather, there is a proper mixing of the distilled water with the stain, and that helps in appropriate staining of the cells. Okay, so once this has been done, after 8 to 10 minutes, now what we have to do is now we have to wash off this slide. So we have to wash off the slide in such a manner that it has to be very, very gentle, so that the entire blood film doesn't get washed away by the excessive, force of the water flowing down. So you have to make sure that the tap that you've opened is quite slow. There is a gentle stream, and then you can there is a technique you'll see in video later on. By placing a thumb on the top of the slide, you can just further slow down the force of water that is flowing down through the glass slide. So by doing this and nicely washing off the stain is essential to obtain an ideal stained smear. So after doing this, now you have to let the smear, or let the blood slide or blood smear, the stained smear, to dry. So you can see in this picture that this is how the stained glass slide looks like after it has been washed and it has been dried. So when you look at it, you have to see that the stained smear is slightly purplish, and then whenever you hold it against the light, then it has to appear translucent. It should not be too deep purple in color. It should not be like extremely, very, very light. But light is okay, but it should not be extremely deep purplish, because that indicates overstaining of the film, and that will give you again a faulty reading. And then it also has to be translucent whenever you hold it against the light. So these are the requirements of the ideal blood smear when you take a look at it with your naked eyes. So once you see that a good smear has been prepared by you, if not, then you have other two smear as a backup. So you can use those smears or those blood films. So once you've chosen the best of it all, now what we are going to do is we are going to examine it under the microscope. So as always, it is good if you start by examining it under the low power lens, just so as to see the under low power lens, so as to see the arrangement, if the arrangement is appropriate, if you have managed to obtain a good quality film in which the cells are uniformly distributed, and then you can proceed to the higher power objective. So once you proceed to the higher power objective, the best the best power under which you are going to count the cell is going to be the oil immersion lens. So it is essential that you have cedar wood oil along with you before you carry out this experiment. So once you put the slide under the microscope, and once you've completed visualization under low power lenses, then now you proceed to are you being able to see the slide, students?
Yes, ma'am.
All right.
Yes.
All right. Okay. So once you proceed so once you've added the oil immersion lens, then you can proceed. Once you've added the cedarwood oil, then you can proceed with the viewing under the oil immersion lenses, which is the best lenses for visualization of very fine details of the cells. It is only under the oil immersion lenses that you will be able to identify and distinguish the different kind of the leukocytes based on their nucleus, based on their granular patterns. So which area of the slide shall you count is also another important question. So it is often seen that whenever you focus your microscope on the slide, it is often seen that the head of the slide is not usually used, because the head of the slide is way too crowded. There are too much of RBC crowding. The cells are superimposed upon one another. Similarly, the red blood cells are also inappropriately stained. So the head is usually not used for counting. You should not start counting from the head of the smear blood film. So the other area in which the RBCs are plenty are in the border of on the edges of the glass slide. But in those edges, even though the WBCs are plenty, usually it is seen that it is not sufficiently stained, or it is very, very poorly stained. So the best area from which you can start counting the WBCs would be from the body and you head towards the tail. Understood? So you start from one segment, you focus now on the body, and once you focus on the body, you start counting towards the end of the tail. And once you've started counting and reached the end of the tail, now you can come down and then again start in the backward direction. So that would mean that you are counting in the zigzag pattern. Do you understand? So you proceed from the body towards the tail, and once you've completed or come at the end of the tail, then you just go down, just move your slide downwards and then come backwards from the tail towards the body, and again from body towards the tail, again from tail towards the body. So this kind of gives you a zigzag pattern of counting the specific areas of the glass slides, and you have to count until you have counted total of 100 number of cells. Understood? So as you, and in this case, please make note that you are going to count the neutrophil, you are going to count the leukocytes. So once you start counting, say 1, and say if you see that neutrophils, now what you have to do is for you to count and for you to make sure that you have counted only 100 cells, it is essential that you are prepared. So what you can do is you can, in your copy, before you start counting, you can make a square, a large square, and you can just divide it into 100 squares. So you have a prepared box having 100 small squares. Now, as you view under the microscope, and immediately as you, the first cell that you identify has been neutrophil, then in the first box you can write N, and then you go on counting. Say you come across another neutrophil again, and suddenly you come upon lymphocyte, then write L. So in this way. Can you hear me, students?
Yes, ma'am.
Are you getting what I'm saying?
Yes, ma'am.
Is this saying yes, ma'am? Yes, ma'am. Everybody is asleep. Khandroma. Yadav Ranjan. Mathela Jyoti. Rishabh Kumar Singh. Tamang Bimala. Nobody is there. Everybody has signed in and left, or what? Anyone?
Yes, ma'am.
Who is this? Yes, ma'am. Jhas Nehraz.
Yes, ma'am.
Looks like all of your friends have gone to sleep and you are the only one who is studying. How do you feel?
No, ma'am.
Everyone is there.
Everyone is there. You can vouch for that.
Yes, ma'am.
All right.
Yes, ma'am.
Yes, ma'am. Where were you? All of you when I was asking for you. This is not fun, no, actually. It's not good teaching like this, for you to be like that, for me to be like this. Don't you guys wish to come back to college soon? This is no way to study a practical, isn't it? You have to be able to do it and see it and feel it. Yes or no?
Yes,
Yes,
ma'am.
ma'am.
So do you miss coming to college? And then you guys, you just had to come and then you had to leave again, isn't it? Especially the students from India.
Yes, ma'am.
Looks like your medical education will be finished online, isn't it? Yes or no?
Yes, ma'am.
Yes, ma'am.
All right, all right. So I hope that you come back soon so that we can do everything in even the practical. Taking practical online is not fun at all. At least theory, it's okay. I can just talk and talk and talk, and then you can decide to listen or not to listen. But whenever I'm teaching physiology, like the practical, I feel like this is not actually how it should be done. But then we have no choice. So okay. So where was I? Where was I? What was I saying? Okay, yeah. and you have to count total of 100 number of cells, and you have to proceed from body towards the tail and then come back down and then proceed from tail towards the body. So in this manner it will be a zigzag pattern in which you are counting. And then it also, like, you will also write, you'll have a prepared box, so you'll already prepare it previously before you do the counting. Make a 100 squared box, small box with 100 squares, and then you will write the initial of each cell you encounter. Okay, so N for neutrophil, L for lymphocyte, B if you manage to encounter the basophils. So that is how you will proceed. All right, so this is how it looks like whenever you so this is how it should be done. Can you see here the box, the 100 box, the 100 number of box? Can you see it here? Yes, so this is what you should do initially before starting the experiment. Draw a square, divide it into 100 smaller squares, and then write it down. As you encounter neutrophil, write N. If you encounter monocyte, write M. If you encounter lymphocyte, write L, until these 100 boxes are filled. So once these 100 boxes are filled, now you are done with the counting. So now what you have to do is you have to calculate the individual percentage. Since we are counting 100, so it is easy. Say if you come across 100, among 100, if you come to, if you get about 60 neutrophils, then you can write 60% of neutrophils, and then 20% of lymphocyte. If you come across basophil, then you can say 1% of basophils. So that is how you are going to do the counting. Okay, so and then you will compare your findings with the normal value. So the neutrophil is considered to be normal if it is between 54 to 62%. The lymphocyte is considered to be normal if it is between 25 to 33%. Slight percentage variations might happen in different books. You can just look in a standard book and calculate accordingly. The monocyte is about 3 to 9%, the eosinophil 1 to 3%, and basophil is the least, less than 1%. Sometimes you might not even encounter basophil, so that's fine. Okay, eosinophil you might just encounter 1 or 2. Monocyte you will encounter very less, but the most of the cell that is encountered is the neutrophil and the lymphocyte. They are very generously spread among the entire slide. Okay, so this is how you are going to do the WBC count. Understood? Yes? Yes or no, students? So lastly, I have a video. I know I always seem to not to be able to. Just a second, okay. Background effect on caption. So I will share with you a video, but for that there is something that I have to do my settings. There used to be an option, no? Let me see if I play the video, if the audio plays or not, okay? So let me know, okay, if you hear the audio or not. All right. Can you hear it?
Yes.
No, ma'am.
No? Why is it always okay? Just a second then. Just give me a second then. Do you know how video can be played? I don't know. I never seem to be okay. Okay, yes. All right. All right. Now, save this, and then I have to share. I think it's visible now. Just a second, okay? Can you see it? The video being played?
No, ma'am.
No, ma'am.
Just give it a second. Give it a second. Now?
No, ma'am.
No, ma'am.
Not yet. Okay. All right, I think I can do that now. Okay, I think it's visible now. Yes?
Yes,
It's
ma'am.
visible now. At least. All right,
Yes,
now I'll
ma'am.
play it. Okay. Okay. The sound is also the audible,
Hello
no?
everyone. Let us perform
Yes,
Yes.
ma'am.
blood smear and determination of differential WBC count. Principles. A blood film is prepared and stained by Leishman stain and examined under oil immersion lens, and different types of WBCs are identified. For our practical, we require glass slides, Leishman stain. Constituents are eosin, methylene blue, and acetone-free methyl alcohol. Distilled water, cedar wood oil, blower, stand, and compound light microscope. Procedure: with all antiseptic precautions, get a finger prick. Here we are using collected sample of blood. To prepare a blood smear, place a drop of blood on the slide. With the help of another slide, make angle of about 45 degrees and move it little backward. Allow the blood to spread with the edge of the slide. Now move the slide in forward direction. Move the slide with uniform speed and blood smear will be prepared. Allow the film to dry. Make 2 to 3 slides so best can be selected for staining. Ideal smear is tongue shaped, covering entire width of the slide and 3/4 of the length of the slide. Uniform in thickness and without air gaps. Place the smear on the stand and let it dry. Pour 8 to 12 drops of Leishman stain on slide. Count the numbers of drops required to cover entire slide. Note that entire blood smear should be covered with stain. Leave it for 2 minutes. Then add double numbers of drops of distilled water over the stain. Note that water should not spill. Mix the stain and water by gently blowing air with the help of blower. Leave it for 10 minutes. Hold the slide in slanting position under the running tap water for about 2 minutes. Wipe the back of the slide and allow it to dry. Take the slide and focus under low power to check the quality of smear and staining. Apply cedar wood oil and switch to oil immersion lens and identify different WBCs. Zigzag pattern of counting cells. Select the area of the tail end of the smear and identify the cell and move towards head end in a single strip running the length of the smear. Then move step down and retrace the path towards the tail end. Continue the zigzag movement across the slide till 100 WBCs are counted. Leukocytes are identified depending on presence or absence of granules. Leukocytes having granules are known as granulocytes, and granules are absent, the cells are known as agranulocytes. Granulocytes are further divided into neutrophils, eosinophils and basophils, and agranulocytes are lymphocytes and monocytes. Leukocytes are identified by its size, nucleus, cytoplasm, color of the cytoplasm, granules present in the cytoplasm, and cytoplasm nucleus ratio. Let us start with neutrophil. Neutrophil is the most abundant cell in the peripheral smear. It is present about 50 to 70%. Cell size 10 to 14 micrometer, that is 1.5 to 2 times the size of surrounding RBCs. Nucleus is multilobed, having 1 to 6 lobes. They are purple in color. Cytoplasm is slight bluish. Granules, they are very fine, like sand particles, numerous and purplish in color. Next granulocyte is eosinophil, which is 1 to 4% in the peripheral smear. Cell size is 10 to 14 micrometer. Nucleus usually bilobed, spectacle shaped and purple in color. Cytoplasm having acidophilic granules, light pink and granular cytoplasm. Granules are large, coarse, brick red in color and they do not cover the nucleus. Basophil, which is less than 1% in peripheral smear. Size of the cell is 10 to 14 micrometer. Nucleus is usually bilobed and purple in color. Cytoplasm is basophilic and appears blue in color. Cytoplasm contains large, coarse, purple or blue granules overlying the nucleus. Small lymphocyte. Small lymphocyte size is 7 to 10 micrometer, size of RBC. Nucleus is single. Color of the nucleus, that is purple. Cytoplasm is scanty sky blue in color. Granules are absent. Single nucleus, which is purple in color, oval or rounded and central in the position. Cytoplasm is sky blue in color and granules are absent. Monocyte is 2 to 8% in the peripheral smear. Size of the cell is 12 to 24 micrometer. It is the largest cell in the peripheral smear. Nucleus is single, usually indented, or you can say kidney-shaped nucleus. Blue in color. Sometimes it may be oval or circular. Cytoplasm is pale blue in color. Granules are absent. Cytoplasm is abundant in monocyte. Amount of cytoplasm is more than the nucleus. And cytoplasm contains nucleus which is peripheral in position. These 2 points, they help to differentiate monocyte from large lymphocyte in the peripheral smear. You can see here, you can easily differentiate large lymphocyte and monocyte by these 2 characteristic features.
All right, so all of you have been able to view it? Yes?
Yes, ma'am.
All right, so
Yes,
that brings us to the end of today's class, okay? So that is how it is done. So it was again a revision about the different kind of cells. This is very, very important. This is very important. It's always asked in exam. So please make sure that you know how to distinguish the cells. Okay, so if you have any questions or any queries, please you can just drop me down any message on the chat. All right, so that's all for today and have a good day. Okay. Thank you so much for tuning in and being attentive.
Thank you.
Thank you, ma'am.
Bye.
Thank you, ma'am.
Bye.
Good day, thanks.